We are here at Villa Pieve in Curciano, and we have this special guest, Carlene Taylor, that we're honored to have here with a program from UNF, Continuing Education Division. Thank you, Carlene.
Well, thank you for the welcome. I'm glad to be here, Rossella.
And well, you know, I think there is not a better person to introduce yourself than yourself. Go on.
Thank you. I'm Dr. Carlene Taylor, and I am a clinical assistant professor at the University of North Florida in the Brooks College of Health. And we have a special relationship between the College of Health at UNF and our Division of Continuing Education for the community. And this is our first program where we're bringing a group of adult, all-aged students to the Villa for a continuing education study abroad. We've been bringing students, regular college students, to the Villa for 11 years now. And we're super excited to have brought a group of adult professionals of all ages and different life transitions to be with us.
Thank you, Carlene. Can you tell me more about your way of integrating different therapies in having the person at the center and having different ways to heal? Because it's just more than therapy, it's like a healing process.
Absolutely. My field is integrative behavioral health and integrated healthcare. In Europe, as well as in the United States, there has been a significant effort to have different professions in healthcare working together for the whole person, to really be able to surround the human, the family, the situation, so that all providers are working together for one cause. And that's the betterment of the patient themselves and their family. It's difficult to get different healthcare providers to be able to work together because their specialties are so unique. And our method, our model of integrative healthcare is teaching all different kinds of healthcare providers how to integrate spirituality, creativity, animals, nature, nutrition, and exercise into their medical practice, whether they're a counselor, or a physician, or primary care, or a physical therapist, or a nutritionist, whatever their medical discipline is. If they can incorporate creative therapies, they have some common ground to work with. And those therapies are holistic. It helps the patient, family, be able to use things that's normal in their lives and not just able to be procured from a doctor.
Do you find that, I mean, we are speaking of healthcare.
Yes.
And just I'm wondering how it can work with the university healthcare division and maybe hospitals and clinic, yes, if there is a collaboration.
Absolutely. So we have an integrative behavioral health clinical training center that is funded by foundations for healthcare system and insurance providers. And that center is in the university, in the College of Health, but we also, half of what we do is teach students and develop curriculum and run programs. But the other half of what we do is we work in the community with clinics and hospitals and different providers who want to incorporate integrated and integrative behaviors, but they don't necessarily have all of the resources. It's one thing to train an individual provider how to incorporate art or music or animals into their practice. It's a completely different service when the system itself wants to make room within itself to bring those services as a normal practice for the whole system. So we do consulting. It's called implementation science research, and it is a specific type of research that allows us to work for usually 3 years with a healthcare organization or an educational institution to help them identify in their organization what needs to change to make room for these creative therapies to be there.
Did you find that there is a resistance sometimes for this new approach, or they're open to that?
They're much more open today than they were 10 years ago, or even 5 years ago. There's been a number of research studies that have been done that have proven that integrative therapies, like the ones that we work with, show benefits for patients and their families in an adjunct, or in addition to the traditional medical model kinds of healthcare. And the research is showing that those holistic therapies benefit patient care. We know that from public health data that people that just live in neighborhoods where there are animals that they have access to, they don't have to have the animals themselves. The health of that neighborhood is better than animals where the neighborhoods where animals do not exist. So because that research is coming and we are seeing those benefits, and because the anecdotal evidence, people are drawn to spirituality, animals, art, music, movement, and nutrition, and all those things. So that momentum has been going, and so now healthcare agencies are becoming more open to it, but it's very different, and it can be a little frightening. Change is often frightening for organizations, and so it's super important to have a knowledgeable guide and a scientific approach to help them make some room.
Carlene, among all things, you are an expert of equine therapy. Can you tell me more about this?
Absolutely. My interest in integrative care came when I began to work with the equine therapy model in the United States. In Europe, as well as in the United States, therapeutic riding and equine therapy for physical disabilities has been popular for many, many years. But around 1990, in the 1990s, we began to discover that the reason why people with physical disabilities were getting better, or some of the reason, was because of the psychosocial benefits. For example, physical therapy works if people do their exercises, but when they're having to do mechanical exercises, there's no motivation. But when they're coming to see a horse and they're riding on the back of a horse and the engagement is with the animal or the dog or whatever it is, that engagement with that animal is the motivating factor for them to show up and the motivating factor for them to do more. We observed that anecdotally, and then as a field, people who were in therapeutic riding began to look a little deeper. I was privileged to be in a very early group of people that had exposure to the field of equine facilitated mental health, and I began studying and working and learning with a number of professionals from the US and Europe that were exploring this, and I built my career out of it. I have a background in equine facilitated psychotherapy, but also equine facilitated learning.
That's very interesting. Also, you came here the first time with this program of nutrition. I know that the healthcare department collaborate with the program nutrition. Yes. How these two things integrate and...
Well, it's a great story. So at the time that I was invited by the longtime director for the nutrition dietetics department that has been coming here for so long. I was invited to come because we were looking for a way to bring interprofessionally mental health providers and mental health students and nutrition dietetic students, particularly to treat eating disorders. And a disordered eating is something that it takes great collaboration between nutrition, dietetics professionals, and mental health providers, because it's not one thing. You can't just address the diet and you can't just address the psyche. You have to address both of them. But it's very difficult to have the mechanism to help those providers work together on one patient. They often work in silos and it's not as effective. So we thought that if we could find a way to bring those two professionals here to Italy, where they're learning together and studying together the same thing, but from their perspectives, that would create the environment where they would be able to work better on eating disorders. What came out of that was we certainly developed a curriculum and the opportunity. So there have been some mental health professionals go each year now with the nutrition dietetics department. But we also were able to explore, by working with your chef, the idea of culinary art therapy as a discipline in and of itself. While I was here doing that curriculum work, what I realized was this didn't just need to be for college students. That yes, college students benefit greatly because they're in a transitional time in their lives. But human beings are always growing and they're always changing. And we all go through different transitions in life where we need to find and grow and find a way to challenge ourselves. And study abroads are precisely for that. It's to expose one to the world, to a different culture and a different way of being while you are in this transition process of figuring out who you're going to be. Who you're going to be in your next life might be when you're 30 years old and changing careers. It might be when you're 50 years old and your children have left home. It might be when you're 75 years old and you're looking at what else do you do with your value. So we designed the trip based on our model of integrative healthcare, integrating spirituality, creativity, animals, and nature, and put it out into the Jacksonville community. We had a good number of people that signed up from the beginning, and then I did an interview on our local national public radio in Jacksonville, and we had an opening for 20 people, and the next day we had 28 people signed up. So it's very popular. A number of people came out of the area saying, I didn't know this exists. How could we do this? How could we be a part of it? And so that's how it came together.
I like a lot your idea of creating an intentional community.
Yes.
Can you explain more about this term, which is pretty new for us?
So, yes, it's new in the sense of being integrated with healthcare, but humans have been living in intentional communities for thousands of years. And what is an intentional community anyway? It's a community that forms, that stays in connection with each other with intention for health and wholeness and wellness of that community. So it's important that you create safety for growth and for development, and recognizing that we're all human beings in that process. Certainly, there are elements of the church that are intended to be intentional communities. Many orders of the church are intentional communities. But there have been many different types of intentional communities. But outside, in the secular world, they're not tremendously popular and they're not tremendously accessible. I was very privileged to be a part of an intentional community, a group of people that they gathered around the ideas of the great psychologist, Dr. Carl Jung, and Jungian psychology. As a graduate student in my master's degree, I found Jungian psychology and I wanted to learn more about it. In American colleges, there isn't a specialization in Jungian, so one must get it from societies and from professionals out in the community. And this intentional community that I belong to was organized around teaching, training, mentoring, and supporting people in learning about Jungian psychology. And in doing that, as a person and as a professional, I was given the opportunity to not only learn the theory and practice, but to be with a group of people who were learning as well. And that intentional community lasted for 11 more years. And out of that, I learned how valuable it is to study and grow and work with people who come from a like mindset. So in setting up this trip, we designed our offering with intention that would attract people who were in a place of transition that would be interested in these principles, which are very strongly based in Jungian theory, and not knowing who was going to come, having no idea. And the people that came were all people that were drawn to that center point. And they came from very different backgrounds, very different reasons for being here, very different places of transition. But they were all have been able, through the program here, to work on what they needed to work on. It's not been therapy. We've not been doing psychotherapy. Nobody's been analyzed. It's been intentional effort.
So, Carlene, talking about spirituality and as a way of healing, you has chosen to come to Umbria because of the Franciscan places, Franciscan story, Franciscan legacy.
Right.
Can you tell me more about your experience?
Absolutely. So Saint Francis is his entire life was built around the intentional community that he was called to at that time. He was not comfortable in the life that he had been born into, and he knew change was needed. And through the life and times that occurred to him, his practice became an act of service. He was turning the world upside down with his ideas. He was an anomaly. He saw the world very differently than it was right now at the time. And through his actions, so many years ago, he set in motion a different way of thinking about relationship to people, but relationship to nature, and relationship to animals, and relationship all the way around, and relationship and responsibility. Our responsibility in community is the higher goal than profit or our own individual successes. And the legacy that Francis, and particularly because of the time that it was in the century, that change was desperately needed. And in many ways, our world today is beginning to look a lot like Dark Ages 2.0, with all of the conflict and things that are happening. And from the foundation of Jungian theory and the intentional community and intentional efforts in Franciscan theology and the way he sees the world and the rule and those pieces, if Jungian theory is the what, Franciscan theory is the how.
Beautifully said. Well, Carlene, where you go from here? What's next?
Well, the community started. It's important that it is at the Division of Continuing Education because it needs to be accessible to as many people as possible. And in the academic side of a university, those are students who are enrolled in academic programs only, and it's limited to just students of those academic programs. Division of Continuing Ed creates a space for anybody from any background to have access. And as a general rule, the expenses associated with continuing education are far less than that of traditional courses, traditional academic courses. So the other reason why that's important is because if I did something personally or just created a nonprofit or whatever to bring this out, it's not sustainable over the long haul. By anchoring our efforts in a university, but in the Division of Continuing Ed, what we create and what we do in this community will be bigger and longer than any individual person's, about sustainability over the ages. That said, that being the context that we're building it in, it is to create an entire array of programming. Some small programs, maybe 1 days, maybe small classes, but future trips that will bring some of the people that were here back for a deeper dive. We're intending a spring trip that some of the folks here are already wanting to sign up for, but it will also bring new people that will come in. And we intend to run the 2 trips for sure here at the Villa Pieve, with a spring trip and the fall trip, with the same basic intention, but approaching them a little differently because of the seasonal differences. And then to nurture that and making all of our resources for these courses, for this experience, to be available internationally, so that it will serve the Jacksonville community and the greater Northeast Florida community. But it's important that what we do will be accessible to people online, the distance learning, and the common ground will be coming back to this place.
I thank you very, very much, and for your time, for your presence here, which has been very important to Umbria, because you brought such interesting new ideas on healthcare. We are exposed to new ideas that we don't have much, and we are looking forward to continue collaboration with you, having you and your group here as much as possible. Thank you, Carlene.
Thank you so much, Rossella, for having me in this process and to be able to talk to you about it and share what we're doing together. It's a very powerful collaboration. The Villa Pieve is an amazing resource. It's a deeply spiritual place. There are many things that are healing, and hospitality is healing. And why people are flocking to Italy and Umbria, the heartland of Italy, is because of the hospitality. There are lots of different types of medicine. And your medicine, the medicine of Villa Pieve and the region of Umbria, is hospitality.
That's good to know. Thank you, dear.